Hello. Hello.
Yes.
Yes. Okay. Thank you, madam. અંકિત આપણા પેજ નંબર કહેશો તમે?
744.
Okay. Sorry for the delay. We reach up to the cardiomyopathy. Cardiomyopathy is the subacute or a chronic disorder of the heart muscles. Treatment is palliative, not curative. Okay, myopathy means gradually deterioration of the muscles, and this is the cardiomyopathy means that cell will be gradually die. No curative, and the client needs to deal with the numerous lifestyle changes and shorten the and there is a shortening of the lifestyle or a lifespan. Okay, what will happen like a chronic diabetes 30 years back and 40 years back, gradually what will happen, the cardiac muscles get tired and there is accumulation of the glucose over there, so there will be a they are not able to contract sufficiently to have maintain the adequate cardiac output. We will see the types and symptom and treatment in a table number 53.6. Okay. Now vascular disorders. Table number 53.6 જોઈ લઈએ આપણે. Physiology, sign, symptom, and treatment of the cardiomyopathies. Okay, there are various reasons or etiology for developing a cardiomyopathy. Okay, hypertrophic cardiomyopathy છે એ બંને છે નોન ઓબ્સ્ટ્રક્ટેડ ઓબ્સ્ટ્રક્ટેડ. અહીંયા છે dilated cardiomyopathy. જો એની અંદર કેવા વેન્ટ્રિકલ્સ છે કેવા ડાયલેટ થઈ ગયા છે, આર્ટ્રિયમ છે ડાયલેટ થઈ ગયું છે, તો આપણે વિચારી શકીએ કે લાઈક ઇલાસ્ટિક છે એને બહુ જ સ્ટ્રેચ કરીએ તો પછી ગ્રેજ્યુઅલી ધ ઇલાસ્ટિસિટી વિલ બી gone. Okay, fibrous and myocardium and endocardium, dilated chambers, mural wall thrombi prevalent, fatigue, weakness, heart failure. Okay, symptoms of heart failure. Again, left side heart failure and right side heart failure. Okay. Anyone from you can elaborate? Tell me what is the left symptoms in the right side heart failure? In morning we have already discussed. Chaya madam or Vrishruti?
Right heart failure, the him, I mean, just 1 second. I was making some notes as well. Yeah, so oh my goodness, what's happening to? 1 second. I'll be back.
It's fine.
Yeah, it's like a jugular vein distended and
Edema,
hepatomegaly. Yeah, and
hepatomegaly, edema, jugular vein distended, and everywhere there will be a fluid in the body. બરાબર, બધી
edema.
જગ્યાએ પફીનેસ હશે, weight gain હશે, water retention હશે, that is because of right side heart failure. And in left side, what will happen? Which organ get congested?
Lungs.
Lungs. Okay, so there will be a symptoms of lung congestion, breathlessness, respiratory distress, hemoptysis, and all. Okay, gradually what will happen? Myocardium get tired, so dysarrhythmia will be there, or otherwise heart block. Block means there is a no pulse, pulseless patient. Okay, or otherwise what will happen? Too much tachycardia or ventricular fibrillation, ventricular tachycardia. So these all are the types of the dysarrhythmia. થાય છે ને એવું કે લાઈક હાર્ટ એટેકમાં પેશન્ટ આવ્યું છે, ટ્રીટમેન્ટ અપાઈ ગઈ છે, હાર્ટ એટેકની પેશન્ટ સ્ટેબલ છે એવું કહી દે, અને લેટર ઓન ધેર વિલ બી અ કોમ્પ્લિકેશન એન્ડ વેન્ટ્રિક્યુલર ફિબ્રિલેશન એન્ડ સડનલી પેશન્ટ ગેટ એક્સપાયર. તો આપણે શું કહીએ કે લાઈક ડોક્ટરે તો કહ્યું હતું કે સારું થઈ ગયું છે ને પાછળથી આવું થઈ ગયું, બરાબર. સો વોટ ઇઝ હેપનિંગ? ધીસ ઇઝ બીકોઝ ઓફ કાર્ડિયોમાયોપેથી. બરાબર, પેશન્ટ હાર્ટ ફેલિયરમાં છે, બધું જ બરાબર થઈ ગયું, પણ એના મસલ્સ એટલું બધું ટોલરેટ નથી કરી શક્યા, તેના લીધે ડિસએરિધમિયા થઈને પેશન્ટ એક્સપાયર થાય છે. ઓકે, સિસ્ટેમિક પલ્મોનરી એમ્બોલાઈ. સિસ્ટેમિક એમ્બોલાઈ હશે તો કોઈ સબસ્ટન્સ, ફેટ, એર ઓર થ્રોમ્બસ, એનીથિંગ ઇઝ મૂવિંગ ઇન ધ બ્લડ સર્ક્યુલેશન. એ પણ મેં સવારે સરસ એક્સપ્લેન કર્યું હતું કે ફરતું ફરતું કિડનીમાં જાય, બ્રેઇનમાં જાય, લીવરમાં જાય, જે ઓર્ગનમાં જશે એ ઓર્ગન રિલેટેડ એના સિમ્ટમ્સ હશે. અને બાજુમાં એવું લખેલું છે પલ્મોનરી એમ્બોલાઈ. તો પલ્મોનરી આર્ટરીની અંદર, લંગ્સ સપ્લાય કરતી આર્ટરીની અંદર જો એમ્બોલસ જાય છે ત્યારે પલ્મોનરી એમ્બોલાઈ, દેટ ઇઝ ધ લાઈફ થ્રેટનિંગ. ઓકે, પેશન્ટ એક્સપાયર થાય એમાં, and that is the always complication of the deep vein thrombosis or a big bone fracture like a femur. બરાબર, તો એ બધામાં આવા બધા કોમ્પ્લિકેશન્સ થાય. એના પછી એવા બે સાઉન્ડ લખ્યા છે. નોર્મલ સાઉન્ડ કયા છે હાર્ટના? S1 અને S2. ઓકે, ધીસ ઇઝ ધ નોર્મલ સાઉન્ડ, સાઉન્ડ જે બધાની અંદર હોય, S1 S2 નોર્મલ. ઓકે, ધેર શુડ બી નો પ્રેઝન્સ ઓફ ધ S3 એન્ડ S4. ક્લિયર? S3 અને S4 સાઉન્ડ કેવા છે? એબનોર્મલ છે. એનાથી વધારે બહુ ટેન્શન કે બહુ વિચારવાની જરૂર નથી. તમારે એટલું યાદ રાખવાનું, S3 S4 આવે ક્યાંય તો ધેટ ઇઝ ધ કાર્ડિયાક એબનોર્માલિટી છે. બરાબર, એટ્રિયમ અને વેન્ટ્રિકલ્સ અનનેસેસરીલી ડાયલેટ થઈ ગયા છે, કોન્સ્ટ્રિક્ટ નથી થઈ રહ્યા, પંપ નથી કરી રહ્યા બ્લડ, તો ધેટ આર ધ કોન્સિક્વન્સીસ. જો S3 છે તો એ ઘણા બધા સ્પોર્ટ્સ પર્સનમાં નોર્મલી હોય. S3 છે એ ઘણા બધા સ્પોર્ટ્સ પર્સનમાં નોર્મલી હોય, પણ જે S4 છે એ ક્યારેય નોર્મલી ના હોય, ધેટ ઇઝ કમ્પ્લીટલી એબનોર્મલ. ઓકે, કંઈક ના કંઈક કોન્જેનાઇટલ એનોમલી પેશન્ટને છે. હવે S4 સંભળાય ક્યારે? હંમેશા પહેલા સંભળાય. S1 ની આગળ S4 સંભળાય. S1 ની આગળ જો થોડુંક લબડબ જેવું થોડો ઘણો સાઉન્ડ સંભળાય તો તમે એને કહેશો S4 છે. પછી S1 સંભળાયું લબ, પછી ડબ તો S2, અને એના પછી થોડુંક સાઉન્ડ હોય તો ધેટ ઇઝ ધ S3. મોડરેટ ટુ સિવિયર કાર્ડિયોમેગાલી. તમારે S1 S2 S3 S4 એની રીધમ પણ યુટ્યુબ ઉપર વિડીયો કરીને સાંભળવાની કે કઈ રીતના સાઉન્ડ સંભળાઈ રહ્યું છે. નો ટ્રીટમેન્ટ, સિમ્પ્ટોમેટિક ટ્રીટમેન્ટ ઓફ ધ હાર્ટ ફેલિયર. બરાબર, હાર્ટ ફેલિયરની અંદર કાર્ડિયાક ડિસીઝીસમાં એન્ટીપ્લેટલેટ છે, એસી ઇન્હિબિટર છે, બીટા બ્લોકર, કેલ્શિયમ ચેનલ બ્લોકર, એસ્પિરિન છે. એમઆઈ છે તો એની અંદર આપણે સ્ટાર્ટિંગ જ આપીએ મોર્ફિન થી કરીએ છીએ કે ભાઈ સિવિયર ચેસ્ટ પેઇન થઈ રહ્યું છે તો મોર્ફિન આપો અને માયોકાર્ડિયમને ઓક્સિજન પ્રોવાઈડ કરો. બરાબર, બાકી બધા છે ને એ એન્ટી હાઇપરટેન્સિવ છે, લાઈક બીટા બ્લોકર, એસી ઇન્હિબિટર છે, તે બધી પ્રીલ વાળી મેડિસિન આવે. બીટા બ્લોકર્સ એની અંદર એટેનોલ એવી રીતે આવશે. ઓકે, કેલ્શિયમ ચેનલ છે તો એની અંદર ડિપિન્સ બધી આવશે, નિફેડેપિન એવી રીતે, સીડી એવી રીતે તમે યાદ રાખી શકો. તો ધેટ ઓલ કમ્સ ઇન ધ કાર્ડિયાક મેડિકેશન, ધેટ ઇઝ અગેન સેપરેટ ચેપ્ટર. પણ એ બધાનો મેઇન એક્શન શું હશે કે ભાઈ વેસલ્સ ને ડાયલેટ કરો. ડાયુરેટિક્સ ઓલ્સો વી કેન ગીવ લાઈક અ લેસિક્સ. કેમ? કારણ કે ફ્લુઇડ વધારે થઈ ગયું હાર્ટમાં, તો પછી તમારે ફ્લુઇડને લોસ કરાવો. બરાબર, કારણ કે શું થઈ ગયું છે બોડીમાં, વોટર ઓક્યુમ્યુલેશન થઈ ગયું છે ને, જ્યુગુલર વેઇન ડિસ્ટેન્ડ થઈ ગયું છે, હિપેટોમેગાલી થઈ ગયું છે, એસાઇટિસ થઈ ગયું છે, પગમાં ઈડીમાં આવી ગયા છે, પિત્તલ એડીમાં. બરાબર, તો ફ્લુઇડ લોસ કરાવવું પડશે તો ગીવ લેસિક્સ. ઓકે, ધેન એરિધમિયા છે તો બધી એન્ટી એરિથમિક ડ્રગ્સ છે, એમ્યોડેરોન છે, બરાબર, ડિગોક્સિન છે, તો એવી બધી ડ્રગ્સ આવશે. તો ધેટ વી નીડ ટુ ગીવ. તો અહીંયા સિમ્પલ વર્ડમાં આપી દીધું છે સિમ્પ્ટોમેટિક ટ્રીટમેન્ટ. બરાબર, હવે એની આગળ છે વાઝોડાયલેટર્સ. બરાબર, ડોપામાઇન, ડોબ્યુટામાઇન, ધીઝ આર ધ વાઝોડાયલેટર્સ. શું કરશે? વેસલ્સને ડાયલેટ કરશે. ઓકે, અને હાઇપરટેન્શનને થોડું રિલીઝ કરશે. કંટ્રોલ ધ ડિસએરિધમિયાસ, તો એની અંદર એન્ટી એરિથમિક મેં જે કહ્યું એમ્યોડેરોન છે, બરાબર, ડિજિટાલિસ છે, કાર્ડિયાક ગ્લાયકોસિડ, ધેટ ઇઝ ડિગોક્સિન, એ પણ આપણે આપી શકીએ. સર્જરીમાં શું છે? હાર્ટ ટ્રાન્સપ્લાન્ટ. કારણ કે જુઓ, આને કોઈ પણ રીતના સરખું કરાય એવું છે? કે ભાઈ કોઈ સેપ્ટમ મૂકી દીધો, વાલ્વ રિપ્લેસ કર્યું, કશું થાય આની અંદર? કોઈ વસ્તુ ના થાય, બરાબર. આની જોડે બાજુમાં પેસમેકર મૂકી શકે, યા તો પછી આખું હાર્ટને ટ્રાન્સપ્લાન્ટ કરી શકે. પેસમેકર થી પણ ના થાય, કારણ કે આની અંદર ચેમ્બરની ઇલાસ્ટિસિટી જતી રહી છે. આમાં કંડક્શન છે, લાઈક એસએ નોડ, એવી નોડ અને પર્કિન્જિન ફાઈબર, બરાબર. એનું જે પલ્સ જનરેટ થાય છે કંડક્શન થી, બરાબર, ઇલેક્ટ્રિકલ ઇમ્પલ્સ છે, પણ ધેર ઇઝ નો કોઓર્ડિનેશન ઓફ ધ માયોકાર્ડિયમ લેયર બીકોઝ ઓફ માયોપેથી. ઓકે, હવે જે હાઈપર, બધાને ખબર પડે છે ને, ઇન બિટવીન યુ કેન આસ્ક. ઓકે, અને જે સ્પેશિયલી નવા સ્ટુડન્ટ છે, જયંતિ ભટ્ટાચાર્ય, ભટ્ટાચાર્યજી, બરાબર, તો એ સ્ટુડન્ટ તમે મને
Ma'am, I
પૂછી
don't
શકો છો.
understand Gujarati, ma'am. Please speak in English or Hindi.
Okay, you are not able to understand Gujarati. Okay,
No, ma'am.
so I try to explain in English only. Okay,
Okay, ma'am. Okay, ma'am.
and in between,
Thank
if you
you.
are not understood in the previous session, you can also tell.
Okay,
Do
ma'am.
you understand what is left side heart failure, right side heart failure?
Ma'am, till I don't understand, ma'am.
Okay.
Till
Right side heart failure, what is happening? Our body weight increase, fluid retention in our body is increasing. Hepatomegaly will there and splenomegaly will be there. Okay. Fluid retention will be there in our body. Whereas in a left side heart failure, what is happening? Lungs symptoms, respiratory symptoms we are having, because there is an increase in a lung congestion because of left side heart failure. Okay. Got it?
yes, ma'am.
Any other students, do you have any problem? Vishruti,
No, ma'am.
Ankit, are you comfortable?
Yes, ma'am.
Okay. Now there is a non-obstructed and obstructed hypertrophic cardiomyopathy. Hypertrophic means increase the size of the chambers or a heart. That hypertrophic, the word it meanings there is an increase in the size. If it is left hypertrophic, right side, left side, left ventricular hypertrophy, then there the left ventricle will get increased. Like here there is a image, or if there is a right hypertrophic, then right side will be increased. So hypertrophy of the walls. See here what is the happening. There is a hypertrophy of the wall is occurring. Because of that, the space of ventricles get decreased. Okay, the blood infilled in the ventricles that get decreased. Hypertrophy of the septum is also occurring. The septum between two ventricles also get the increase in a size. Hypertrophy, in simple word, there is an increase in a number and size of the cell and tissue. Relatively, the size of the chamber get decreased. What are the symptoms in that? Dyspnea, difficult breathing, angina, chest pain, fatigue, syncope like a fainting. Okay, you feel like a fainting, or okay, palpitation means you feel like you are hearing your own heartbeat. Then mild cardiomegaly. Okay, if we are taking a X-ray, at that time we can see there is a increased size of the heart. Okay, as for gallop we are hearing. Okay, can anyone tell me what is the S3 and S4? Are they normal or abnormal?
Abnormal.
Abnormal. Okay.
Mm-hmm.
Yes. Then what will happen? Ventricular dysrhythmia will take place. Sudden death also very common in this type of patient, and heart failure. We have already discussed the symptoms of heart failure, that all will be there. Now obstructed in what happens, same as the non-obstructed, except for the obstruction of the left ventricular outflow. There is a obstruction track associated with the hypertrophic septum, mitral valve, and incompetence. Mitral valve is also incompetence, and previously we have discussed what is stenosis, that is the narrowing. What is incompetence means there is a backflow or regurgitation of the blood will take place. Okay, in obstructed ની અંદર that valve get obstructed, mitral valve get obstructed. Same as a non-obstructed, except the mitral valve regurgitation murmur also we are going to hear with the S4 gallop. Okay, two type of sound we are going to hear. There is also atrial fibrillation. Ankit will knowing what which type of strip will be there. Can you tell, Ankit?
There will be like no P wave or absence or irregular.
Is pattern of the ECG lead will be there. Okay. કર્વતના સરફેસ જેવી એવું કહેતા હતા ને?
No, that is ventricular fibrillation.
Okay. Then restrictive cardiomyopathy, that is the mimic constrictive pericarditis. Fibrous wall cannot expand or contract. See, the word itself explain us it is totally restrictive, not more movement or a contraction there. Okay, but here it is seen in the one side wall, that is the left side wall. And there is a development of the fibrous, like a cirrhosis of liver. We are observing the fibrous. And other organs also there is a fibrous development is there. Same like over there, here in the cardiac, myocardium get fibrous tissue. Chambers get narrowed and emboli is very common. Now, what are the symptoms? Dyspnea, fatigue, heart failure, especially at right side, mild to moderate. Okay, why there is a right side heart failure? We are observing abnormality in the left side. Then why there is a right side of problem? Because of backflow. Okay, lungs get congested and heart is now so much accumulation of the blood over the right ventricle, and gradually what will happen? Right side heart failure. Okay, mild to moderate cardiomegaly we can observe in the X-ray. S3 and S4 sound we are easily heard. Heart block, there may be a chance, and there is also chance of emboli, or emboli gets circulated in the systemic or a pulmonary circulation. Now, what are the treatments? Okay, here in the obstructed and non-obstructed cardiomyopathy, again symptomatic, beta blockers and cardioversion of for the atrial fibrillation. Okay, cardioversion is given when there is a fibrillation, too much heart rate, too many heart rates are there at that time, and if there is a pulse are there, then there is a cardioversion should be given. Surgery, that is the ventriculomyotomy or the muscles resection with a mitral valve replacement. Okay. Hello. Niyanta. 1 minute. Hello. Hello.
Yes, sir.
Okay. Then surgery. In surgery, what we are doing? Cardio ventriculomyotomy. Okay. Myotomy means opening of the muscles or a muscles resection. Here it's written like we are doing in the pylorotomy or in the pyloric stenosis. We are doing the surgery same like over here. Muscles resection will be there, or otherwise there may be a chance of mitral valve replacement. Okay, we are replacing total valve. Again, here there are a list of medicines like a digoxin. What is the action? It is digitalis and regulate the heart rate. Nitrates, okay, relieve the pain. Vasodilators, okay, that will dilate our arteries and relieve the load of the heart. Contraindicated with the obstructed forms. If there is already obstruction at that time, we are not going to give this type of medicine, okay? Because there is obstructed and we are already atrial fibrillation is there. Fibrillation means too many heart rates and we are giving digoxin, then there is a chance of irregularities and more complications. Supportive treatment for the restricted cardiomyopathy, that is again supportive, then treatment for the hypertension, like which are the drugs? Beta blockers, AC inhibitor, calcium channel blocker that we should give. Conversion for the dysrhythmia patient when there is a pulses are present. બરાબર તમે બધાએ defib જોયું હશે. Okay, we are giving shock with the defibrillators. Okay, that is only and only for the patient who are a pulseless. Okay, or there is a heart block, or otherwise with the rest of the patient we are only and only go for the cardioversion treatment for all type of dysarrhythmias, ventricular tachycardia, atrial fibrillation and all. Exercise restriction, okay, for all cardiac patient. Emergency treatment for the acute pulmonary edema we need to give. Now, vascular disorders. In that first, venous thrombosis. Thrombus means what? Anyone from group?
Clot formation.
Huh. Clot formation, blood clot it may be, okay? Or emboli means it is a blood clot or a fat or release from somewhere or air emboli. Okay, but when it is the thrombus, then most of the time after post-operative phase or any type of accident, okay, there is a some thrombus that release or because of vein rupture and move into the circulation. Okay. When the thrombus develops, inflammation occurs, thickening in the vein wall and leading to the embolization. Here there are certain types of the thrombus. First, that is the thrombophlebitis. Thrombus associated with the vein inflammation. Phlebothrombitis. Thrombus without the vein inflammation is there. Okay, because of any type of surgery or any blood clot there at that time. Then phlebitis, like sometimes DIC is there and there is a clot formation and then it will move. So that is called phlebothrombitis. Then phlebitis, vein inflammation is there because of any reason, post-surgical or any reason associated with the invasive procedures such as IV line. Okay, in burns patient or sometimes it may be very common. Deep vein thrombophlebitis, more serious than the superficial thrombophlebitis because of the risk of the pulmonary embolism. Okay, and that will occur because of the post-operative condition if we are not ambulating patient in the early phase. At the upside in the box number 53.8, there are also certain instructions regarding following valve replacement. Okay, what the client education for the patient who are undergoing valve replacement. This is again, it is the box. So we need to refer for the 3-4 times and there are so many questions regarding client education. Adequate rest is important. Fatigue is very common in the cardiac patient. Anticoagulant therapy is necessary if mechanical prosthetic valve has been inserted. Otherwise, there is a chance of again clot formation and thrombus. So we need to give anticoagulant therapy. Okay, like antiplatelet, heparin we should give, aspirin we can give. Instruct the client concerning hazard related to anticoagulant therapy and notify the primary healthcare provider or cardiologist of the bleeding, of any bleeding or excessive bruising. Okay, we are providing anticoagulant therapy like heparin. Okay, after surgery, if there is any kind of concealed hemorrhage or an internal hemorrhage is there, or BP is low, at that time, what is our first action? To inform cardiologist or a primary healthcare provider. PHCP, no, I have already previously explained what is the PHCP, primary healthcare provider. Okay, in the foreign country, that is the very common for all type of doctor it is used, or other cardiologists we need to inform regarding bruising and bleeding. Monitor incision and report any drainage or redness. If you observe at the operative side there is a drainage, excessive drainage or redness, then we can inform. Instruct the client concerning the importance of the good oral hygiene to reduce the risk of the infective endocarditis. We have already learned endocarditis topic. In that also it is mentioned if there is a poor oral hygiene that will lead to endocarditis. And it is very, very important in the all pregnant mother, okay, to maintain oral hygiene. Is it clear? If we are not maintaining good oral hygiene, then what will be the result or risk? Infective endocarditis. Okay. Brush teeth twice daily and soft toothbrush should be used to prevent gum bleeding, followed by the oral rinse. Okay. Why we are thinking regarding gum bleeding? Anyone from you? Which medicine we are administering to patient? In this box
Anticoagulant.
only it is written. Yes, very good. Anticoagulant we are giving. Okay, so there is a chance of bleeding, bruising, and gum bleeding. Avoid irrigation devices. Okay, irrigation devices avoid कराना चाहिए. Avoid use of electronic brush. Electronic brush are available in the market, and we are generally using for the pediatric client. Okay, that we need to avoid. Flossing, okay, removing the dirt between the teeth. We need to avoid that because this activity can cause the gum bleed. And after gum bleeding, what will happen? The bacteria will go into the bloodstream and endocardium in the heart, allowing bacteria to enter into the mucous membrane and bloodstream. Avoid any dental procedures for at least 6 months. Underline it, it is very much important. After any type of, not this one, valve replacement, any type of heart surgery, we should avoid a dental procedure till 6 months. Avoid a heavy lifting more than 10 lbs 4.5 kg as prescribed, or exercise caution when in an automobile to prevent injury and sternal incision. If a mechanical valve are inserted, a soft audible clicking sound may be heard. That is normal. Instruct the client concerning the importance of the prophylactic antibiotics before any invasive procedure. And the importance for informing all primary healthcare providers of a history of the valve replacement and repair. Okay, so they can give the medicines, or if there is any type of MRI, CT scan they want to perform, then they will keep it in their mind. Obtain and wear the bracelet like a medic alert bracelet. Okay, now come back for the thrombus and phlebitis. We have already learned regarding thrombophlebitis, only vein inflammation, phlebothrombosis, thrombus without a vein inflammation. ક્યારે થશે? DIC, disseminated intravascular coagulopathy, your coagulation. તો એની અંદર internal bleeding માં clot formation ચાલુ થઈ જશે. That also lead a thrombus. Now phlebitis, vein inflammation associated to the invasive procedure, and deep vein thrombophlebitis always occurring post-operatively and it is fatal. Okay. Now, risk factor for the thrombus formation. What are the risk factors? Venous stasis from the varicose vein, heart failure, or the immobility, or especially immobility after the any type of surgery. You all might be knowing regarding the early ambulation concept.
Yes.
Vishruti, are you comfortable?
Yes, ma'am.
Okay. એવું આવે છે ને કે જેવું સર્જરી થાય તો બીજા દિવસે પેશન્ટને ઊભા કરવાનું. We believe that early ambulation means next day of surgery or within few hours, 8 to 10 hours, we make the patient walk at
Mobilize.
least, and we need to remove the catheter. Okay, so why? To prevent deep vein thrombosis, and that is the another reason. What other reason, Ankit?
To prevent lung collapse.
Yes,
At
very good. To prevent lung collapse and atelectasis. So for that also we are giving spirometry. Okay, these two are very common complication for post-operatively. For that we need to look after. Another risk factor, that is the hypercoagulability disorder. Any disorder which cause internal coagulation of the blood. At that time we need to be alert. Like I have already given DIC, very common disorder. Injury to the venous wall from the vein injection. Okay, what are happening if we are inserting frequently in a one vein? Okay, in a one puncture only, withdrawing and giving in one puncture only. At that time, there is a chance of inflammation. Administration of the vessels irritant, especially chemotherapy, hypertonic solution. Which are the hypertonic solutions?
D5,
Anyone?
D10,
Very good. Dextrose 5%, dextrose 10%, that are the hypertonic solution. Okay. Hypertonic solution clear. D5, D10. What is the hypotonic solution? 0.45 NS. That is the hypotonic solution. And isotonic means 0.9. That is the isotonic. NS, normal saline, that we are generally using. And other isotonic is
RL.
RL, ringal lactate solution. Okay, that isotonic means the solution osmolarity is very much similar to our body fluid osmolarity. Okay, so no need to give other additions. If there is a diarrhea is there, or if there is a burns is there, so blindly we can administer ringal lactate solution. If there is no need other treatment, and we just want to give a fluid, at that time also we are just giving normal saline. NS. Following surgery, particular orthopedic or abdominal surgery, there is a more chance of develop of the thrombus. Okay, especially yaad rakhwanu femur fracture. Okay, large bone fracture that will lead to the emboli, pulmonary emboli, because of fat thrombus. Of pregnancy, I have informed you regarding DIC, very common after postpartum hemorrhage, disseminated intravascular coagulopathy. Other, that is GI condition, ulcerative colitis. Okay, there is an ulcer in the colon, and that ulcer get more inflamed and colon get inflamed. That is the ulcerative colitis. Use of oral contraceptives, that will again lead to the thrombus formation because of hormone imbalance. Certain malignancy will lead to hormone fracture or other injuries of the pelvis or a lower extremity. That I am always telling you, fracture of the femur. There are some questions that are always coming regarding the fracture of femur, and like they are asking, is it emergency fracture of femur? And there is a in other disease like pneumonia, COPD, okay, CV stroke, like that type of diseases are there, and we are thinking like CV stroke are might be emergency, okay, but it is not emergency. The main emergency is femur fracture. Okay, CV stroke, after CV stroke and certain treatment, the patient will be stable, and there is no any sudden changes will occur. But in femur fracture, there is a chance of the thrombus formation and pulmonary embolism. Means the condition of the patient will be worse. Okay, now the phlebitis. At anywhere, if you are not understood, then let me know. Phlebitis, that is the in assessment, red warm area radiating up the vein and the extremities. Okay, the area gets red or sometimes purple. Okay, pain will be there and swelling will be there. Interventions include apply warm, moist soaps as a prescribed to dilate the veins and promote the circulation. Assess the temperature of the soap before applying. Assess the sign of complications such as tissue necrosis. If there is a bluish discoloration and black, then infection and pulmonary embolus. Deep vein thrombosis, the calf or the groin, tenderness or a pain with or without swelling. Positive hormone sign may be noted. However, false positive results are common. So this is not reliable assessment to measure the sign. Warm skin that is tender to touch. Provide a bed rest. Elevate affected extremity above the level of the heart as prescribed. Avoid using knee gauge or a pillow under the knee. Okay, don't use a pillow or any comfort device below the knee. Do not massage the extremities. We are thinking like it is painful and we should give the massage. It's not like that. Don't give massage in the deep vein thrombosis. Underline it. Provide a thigh high or the knee high anti-embolism stockings. Okay, and stockings are available on the Amazon. You can also visualize. Okay, and it will give a little bit compression. It should be wear in a proper way. There should be no wrinkle in the stocking. The length we need to select like a knee high up to knee or the thigh high up to thigh we need to wear it as prescribed to reduce the venous spaces and assist in the venous return of the blood to the heart. Teach how to apply and remove the stocking. As I have told you, it is very much important to know how to wear a stocking and it should be removed at night time. Administer intermittent and continuous warm moist compresses as prescribed. Palpate the site gently. Monitor for the warmth and edema. Okay. So, monitor for the intermittent moist warm and edema. Measure and record the circumstances of the thigh, circumference of the thigh and calf levels, whatever. And is there any swelling is there that we need to understand. Monitor for the shortness of breath, all the lungs complications like a shortness of breath, chest pain, which can indicate pulmonary embolism. જે મેં કહ્યું હતું, it is very much fatal. Administer thrombolytic therapy, tissue plasminogen activator, if prescribed, which must be initiated within 5 days after the onset of the symptoms. Okay, within 5 days. Okay, after heparin therapy, administer heparin therapy to release the clot. Okay, or make the blood thin. Heparin therapy as prescribed to prevent enlargement of the existing clot and prevent the formation of the new clots. Monitor activated partial thromboplastin time, APTT time. That is very much important for the heparin therapy. Administer warfarin, that is again anticoagulant, as prescribed following the heparin therapy. When the symptoms of deep vein thrombophlebitis have resolved. In primarily, we are administering heparin and later phase we are administering warfarin. Both are the anticoagulant. Monitor for the prothrombin time and normalized ratio, INR ratio, which is important for the warfarin during the warfarin therapy. Okay. For warfarin therapy, there is a PT and INR ratio is important, and for heparin therapy, APTT time is important. These all concepts, I think, Ankit will remember, and we have discussed in the fluid electrolyte chapter.
Yes.
Monitor for the adverse effect associated with the anticoagulant therapy. Here there is one more box that is the instruction for the client with deep vein thrombosis. Okay, instruct the client. Okay, if you have observed, there is some green vein on the uh, uh, lower extremity, especially near to the ankle area. Okay, and it visualizes like a very thin vessels vein. Okay, so that is all because of varicose vein. Okay, or deep vein, similar to the deep vein thrombosis. Vein get affected in the after surgery. Instruct the client concerning the hazards of the anticoagulation therapy, like if there is a chance of internal bleeding, bruising, okay, that we need to explain them as we have discussed previously in cardiomyopathy. Recognize the sign symptom of bleeding, that is again very much important. Avoid prolonged sitting, standing, constructive clothing, crossing the leg when seated. Okay, that we need to avoid. Elevate the leg for the 10 to 20 minutes every few hours each day. Okay, keep the foot or legs elevated for at least 20 minutes. Plan a progressive walking program. Inspect the leg for the edema and measure the circumference of the leg. Gonna, like you have seen, so many old age ladies have a swollen ankle, especially ankle pain and swollen ankle and foot. Okay, that all have a same kind of complaint. Wear a anti-embolism stockings. We have already discussed regarding stockings like the knee length stockings, thigh length stockings. Okay. As prescribed, avoid smoking, avoid any medication unless prescribed by the primary healthcare provider. Instruct the client concerning the importance of follow-up primary healthcare provider visits and laboratory studies. Obtain and wear a medic alert bracelet. Okay, now another topic that is the venous insufficiency. Okay. Now today we are having a two more candidate in today's lecture. I want to know regarding Jayanti. Please switch on your video.
Yes, ma'am.
All please switch on your video. Okay, Jayanti, you are from where?
From Jharkhand, Tata Nagar, ma'am.
Okay. English is good for you?
Yes, ma'am.
Okay. And you have completed BSc nursing?
No, ma'am, GNM.
Okay, you have completed GNM. And do you have any experience? Clinic
Yes,
experience?
ma'am. Clinical experience, 10 years of experience.
Okay, very good. Okay. Now, Kinjal, do you please introduce yourself?
Yes, I am from USA.
Hmm.
I have a various hospital experience, 10 years experience. I have no book for because long time. So come here. That's why.
You have a gap for
Yes.
the study. Okay, but you
Yes.
have worked over there, so you can also give your experience, share your experience, and it will be helpful to us. And
Okay.
while teaching, also you can realize like here it is happening. Okay, so over
Yes.
there you are working at hospital side.
No, I'm not working here. I'm working here, but not in hospital. If I
Okay, so
clear
it is
RN,
clinical.
if I clear RN, after that I work.
Okay,
So can you tell me about
like
what topic you, because I'm started 2 minute ago, I don't have any clue. So what topic
okay.
you start?
See, here this batch is going on for the Ankit. Ankit has joined this batch from August. Like August, we are
Okay.
started our syllabus. Like from F1, acid base balance and nutrients and everything we have learned. For all the candidates, I am informing you. But now we have our remaining 4, 5 systems.
Okay.
It's 1 minute. So we are going for a in little bit speed. So there is a
Okay.
chance you might not understand the topic. If you have any query in between, then you can ask. Okay?
Okay.
If
Okay.
you are not
Okay. No problem.
understood any terminology, write it down at that time, particular time. Or after lecture also you can search it.
Okay.
Okay? So it is like a cardiac condition we have learned. In that starting,
Okay.
we have already discussed anatomy, physiology, ECG pattern, diagnostic test, and
Okay.
infection and other conditions of the heart we have completed. But later on, you can also join other lectures are going on regarding cardiac in MAC
Okay.
education, as there are already other lectures are going on.
Yes.
So
Yes.
you can join over that. And
Okay.
this chapter will complete soon. My lecture is at the 1 p.m. as per the Indian time, 1 p.m.
Yes. Yeah. Yeah. I
And
know.
that lecture I am
Hello.
continuing at 9 p.m.
9 p.m. Okay.
So I
9 to
request
11.
all our participants to
Yeah.
attend both the lectures. Otherwise, what will happen? A small funda I need to explain again and again. It is
Yes.
already
But
revision for the
I am not
repeat.
attend 1 p.m. classes because their time here night. So
Okay,
1 to 2 class I don't attend. So I attend only
okay,
morning classes and night classes. Your India time is
okay.
morning
So
and
you are
this night.
attending, I think, 9 to 11. You are attending 9 to
Yes.
11 class.
Yes. Yes. Yes.
Okay. So that is fine. Ultimate, our goal is to finish the Saunders at least once.
Yes.
Okay.
Okay.
So this book is very much important for the NCLEX examination. Even for a small sentences, there are having so many questions in different form. So
Yes.
it is important to finish this book at once. And another thing is important, while going with the particular chapter, you try to complete the question answers
Yes. And
from
answer. Yes.
UWorld or any other software. So you can
Okay.
understand nicely. Okay.
Okay.
Like if we
Okay.
are going with the cardiology, then you can solve that question so you can understood well. Don't jump on other questions. We
Other
are not
question.
in hurry. Okay. Chapter wise solve the question answers.
Okay.
Now
Something, please.
other student.
Hello. Can I ask something?
Uh-huh.
Hmm. Because
Uh,
like maybe I'm going
uh,
to
there is a
say
net connect
so
poor net
that
connection.
little bit and um, again,
I'm not able to hear.
can you hear?
Hmm. Hello.
Hello?
हाँ मैडम.
Hello?
Hmm.
Can you hear me?
I think you might having a problem during lecture also. Other students, are you able to hear me perfectly?
Yes,
Yeah,
miss.
I don't know what happened. I'm fine. Well, I can hear you as well. Well, I don't know, suddenly it's gone.
Yes, now tell me. Now your connection is okay, I think. B-
Can you hear? Okay, yeah. What I'm saying is like because as I also started the classes today only, and because of these things like the syllabus giving me the like index that I have to check everything as well. But it's like you are going quickly. I appreciate that from meeting because I have to make sure that he solves, before he does that. But like, I haven't have any idea about what happened in the front before this 50-60% finish. So, so how am I going to go again stars. Because like I thought, if class is starting on 3rd February, that means it's the beginning of the classes for everybody who's actually on the class, doing it for months, and now we are just brand new who's starting now. So I think this is like a little bit of confusing here. And when I come here, like you said S1, S3, S4, no idea, because I wasn't attending that one, you see. So I think
So I have told you,
the lady who did the same thing. Mhm.
might have problem for 1 or 2 lectures. Later on, we will shift for the another system. So that gradually you will understand another system. And this cardiac system, you have again have a chance to revise it. S1, S2, there is a no more. That the thing is there, I have already explained. S1 and S2 is the normal sound. S3 and S4 are the abnormal sound. Very clear? Everyone have the
So,
S1 and
yeah,
S2 sound.
yes.
S3 sound is only and only present in the sport persons. Okay. And it is here after S2 sound. S1, S2 and S3. Okay. There is a very short duration between S2 and S3. Okay. But S4 is very much complicated sound and it shows any cardiac abnormality. પણ એ ક્યારે સંભળાશે? Just before the S1. We are able to hear the S4 just before the S1. Or if you are
And when
hearing anything, but for this you need to experience from the YouTube
why is
video.
that comes? Is it monitor?
How this rhythm is going on, you can hear that.
Okay, okay.
Okay. So no, make it not then whatever I am having the knowledge.
Find
I am
out, yeah.
not so much expert in the sounds, but whatever I am having, I will share with you. Okay.
Mhm. I get what you mean. It was just my definition of that. Like I didn't read about it before. But, what do you remember the S4 means? So what is the definition of the sounds S4? Because there's 12%. I was sure, but Google search as
Okay. Anyone else have anything to share? Okay. Should we stop here?
Yes, ma'am.
okay. Mhm.
Bye. Bye.
Hello, yeah, I can hear you now. It was gone
You want to
completely.
talk? You want to talk?
No, it's okay now. At least you gave me the answer because I was a bit afraid that now what am I going to do with all the other which I haven't managed to finish it. And now like they will think that I've done my cardiac system. I haven't. And same thing happened in the mental health today. I was attending for Akshara and it was like so many other part is gone. And I said, oh my God, now I'm halfway because my idea was only that the new students are starting from yesterday. I didn't know that there are some senior students are already there as well. That was the only issues, yeah.
But listen, madam, like this cardiac system I am teaching, that is again new for Ankit.
Okay,
Renal system, that is the new for Ankit.
okay,
So
okay.
sometimes what is happening, diseases is very much easy to understand, but some basic funda is difficult. So some teachers starting from the adult health nursing, like you might
Mhm.
heard like angina pectoris and MI and all. So people are starting from adult health nursing to understand it is very much easy, like a symptoms and etiology and treatment, like. But in
Mhm.
FON, it is little bit difficult, like ethnicity. If I am teaching you African, Hispanic, then you don't like to learn that right now. So that
Mhm.
is fine. In NCLEX, na, every chapter is different. So if you all have started, so I little bit slow in teaching to
Okay.
you all. Otherwise, if there is Ankit is there, Ankit, Nidhi and Kenny, 3 students were there. Remaining
Yeah,
have left in between because
I
it
can
is
see
long and tough journey.
it is.
So it is But if you do
It's
hard
going to
work,
be.
then you will sure achieve, madam. You will
Okay.
sure
So
achieve. You have worked in.
are we going to get this book like Saunders, yeah? And so I can exactly what you're showing me now on the screen, like all the notes. Is it from the Saunders? Is that correct?
Saunders.
Is that from Saunders? Okay.
The,
So the Saunders book
in
is missing.
NCLEX whole the world, there is only one book, that is the Saunders. It's like
Oh,
a Gita.
really? Okay. Okay.
We only have to learn from Saunders only, and each and every sentence. So we are trying to finish or to read everything in all lectures. So
Okay.
sometimes we go fast if it is discussed previously. So it is like that.
Right. Okay.
But it is easy if you are learn like if you attend 3-4 more lectures, then you are being used to.
I'm sure I would be because this is first one, and I was even messaging Ankita. I said, I'm a bit scared now. Actually, my age, and now this is thing. Oh my goodness, it's coming again now to me because even my
I
son, he's a
inspired
medical.
from your
My
I
son,
inspired from
he's.
you.
Thank you so much. My son is actually a medical student. He's in a fourth year. He's going to be a doctor here in UK. And he said to me, "Mom, I'm really looking up to you that you're going to learn again." I said, "I really don't know why am I doing this, but I have to now. There is no choice. I have to do this. There is no choice for me."
Now I am planning to give OET.
What does it
Is
mean?
it good? OET.
OET. Oh,
OET
okay.
exam.
Ah, well done.
So after seeing you, I thought I should do OET because my son is
I'm
13
sure.
year old. So I
Oh, you
thought
can.
like to moving abroad
Yes,
or like
I'm
that.
sure you can do it. I'm sure you can do it. Yes, we all can inspire each other.
Okay. Anything
Right.
else?
No, that's good. Yeah. Now at least I'm a
So
bit
keep it up.
okay.
Keep it up.
Yeah. Yeah. Thank you.
Okay. Good. Bye.
Okay. Bye.
Bye bye. Thanks.
Bye.
Thank you.
Bye.